Hello to everyone on YouTube. Hello to everyone on TikTok. I am here for our Tune In Tuesdays, where I will, in about 40 minutes or so, try to see how many questions I will get to on your live, whatever hormone questions I can answer to you. There's a little bit of a lag in the questions, so be patient. I will get to as many as I can in the next 30, 40 minutes or so. As always, I'm a doctor. I'm a traditionally trained OB-GYN, traditionally trained OB-GYN, but I am not your doctor, so I can't answer any direct medical questions, but I'm happy to try to point you in the direction to help you with all your hormone woes. So for those of you that aren't following me here, give me a follow. Check out my YouTube, give me a follow and a subscribe. We are also working on a weekly free newsletter. So if you haven't subscribed to that, make sure you do that, and you're not following me on Instagram. Questions are starting to come in, so I'm going to go ahead and start that. Allie, is it okay to take wild yam to get cream and progesterone together in early pregnancy? Well, first of all, I would tell you there's no studies on wild yam cream during pregnancy, so I wouldn't suggest taking anything that hasn't been extensively studied in pregnancy. From about week 7 to 19, sorry, 7 to 14 is when all the embryos form their organs. So if it were me personally, I would not take anything that hasn't been extensively proven safe. Now, we know progesterone is safe because we use it in reproductive cycles. So I would, if that's been prescribed to you, I think that's fine. Good luck to you, Allie. Ned the Hunter, hi, good to see you. Hustler, good to see you. I'm talking funny because I have my Invisaligns in, so bear with me. Nancy Alvarez, thanks for joining in. What are your thoughts on losing weight when taking a progestin pill? I'm losing 2 pounds a week. That's very unusual. I would wonder what the issues are. So part of me is thinking it's not necessarily due to the progestin, but what the progestin is doing. A progestin pill is made to suppress ovulation. And maybe you're one of those people that during ovulation produces a ton of estrogen. So it's suppressing or stabilizing that. And that's why you're losing some weight. So it could be. Maybe that's just a side effect. Maybe it's a coincidence. Thank you guys for the badges. I don't know what that means, but thank you so much. For those of you that are joining, we are here on Tune In Tuesdays. So those of you in YouTube, I do have someone reading the questions. My assistant will read the questions if you have anything that you need me to answer. This will actually be available on YouTube later. I guess it's just a format that's a little bit easier to search. So if you're not following me, Tara Scott, MD, you can probably also find me as the Hormone Guru on YouTube. I think it's a little bit easier to search the content there. So thanks to you guys who are just joining in. We do have a weekly free newsletter that we're trying to put together a lot of content. Let me know what you want to hear about. If you want to hear more about hormones, I'll just keep reading about that, trying to make some more wellness. I'm very, very passionate about wellness because of my family history, and my brother died at 38 of a heart attack. User 484849, thanks for joining in from Akron. Woo woo. Andrea, thank you for sharing the live, and thanks for joining in. What are you guys' long questions about hormones? What are your questions about metabolism, about thyroid, about adrenal issues? Do you guys have some supplement questions that you're curious about? Nicoluna, what do you feel about wild yam cream in general? Well, let me tell you, I don't think it can hurt you. I don't know that there's actually any active progesterone in there, but it could help your symptoms. It's not something that I would recommend taking every single day. I would probably cycle it like we do cycle progesterone, but certainly have the ability to get prescription progesterone that's been FDA approved, or even bioidentical progesterone that's been compounded and has been third-party tested, then that might be a very real option for your symptom relief. It is not going to do the same thing as progesterone, which is downregulate the estrogen receptor and decrease the growth in the uterus. But it can help your symptoms. Gina, very low TSH, high T3, lost period since month 8. 2024, I'm on progesterone, I take it daily. So that sounds like you're a little bit hyperthyroid. What I would really like to know is what your free T4 is, what your TPO antibodies are, what your TSI antibodies are. Do you like to give it cyclic, which means when you start your period, day 1 of full flow, you stop progesterone. Depending on how old you are, if you are in the fertility age, we would have you stop it for 2 weeks. If you're in the perimenopausal age, we have you start it at day 10, and if you're menopausal, we have you stop it during the period. Okay, let's see.
Cindy wants to know where you're located.
Cindy wants to know where I'm located. I am in Akron, Ohio. I am licensed to practice medicine in Ohio, and our rules in Ohio dictate that we have to see patients face-to-face for the first visit. Ardit, why does TRT deplete the natural overall testosterone? That's a great question. So a couple things. Hormones have feedback loops. So if you're getting a high dose testosterone and your levels are high, as often it is with testosterone replacement, because, and that's a long story about how people monitor it and how they. And what that does is sends a feedback back to the brain to suppress your LH, which LH is what causes you to make testosterone. So make sure you know, all you men that aren't testosterone, especially if you're younger, it's going to cause your balls to shrink. I don't know if I can say that on a live, but it does cause shrinkage. Magdalena, Lou, how about turmeric in capsules? So turmeric is one of the supplements that I do like, and I recommend frequently for an anti-inflammatory property. There are probably lots and lots of different brands, so make sure you're finding a brand that is third-party testing, purity testing, and validated, which means they've gone through the trouble to have an outside party. Make sure that what they say in the label actually is in there. Oh, hello from Nashville, Tennessee. We're actually headed there later this year, and I've been there to speak before. So are hormones helpful for menopause? So I'm actually speaking at a conference next month. So every time I go for this conference, I have to update my slides and make sure there hasn't been any new articles. So the hormone therapy lecture I was looking at today, there's been a couple new in the last year articles published that there's been a decrease for lots of causes of death for people who took hormone therapy, dementia, cardiovascular disease. And so there are, I think for most women, and this is what the Menopause Society says, that for women between 50 and 60, without any contraindications, which is really just breast cancer or recent blood clot, that there are more benefits than risks for taking it. SAP stables, I'm tired all the time on HRT and thyroid. I have labs checked and they say I'm fine. So a couple things. Labs depend on what you're taking, how you're taking it, when you're taking. I wonder if they told you to take your thyroid at a certain time and then told you to get your blood drawn. We are very intentional about what time we tell you to get your blood drawn. We also do a full thyroid panel with the TSH, free T3, free T4, reverse T3. Other causes for fatigue could be your cortisol. Maybe that hasn't been properly assessed. Low androgens. I wonder if your DHEAS and DHEA and testosterone have been assessed. It could be low iron, of course. It could be gut issues. So there's several things, SAP stables, that could be causing your fatigue. Andrew, thank you for sharing the live. Okay, let's see. I skipped a few things. Going back to the beginning. Okay. User 4849, my OB-GYN said it doesn't make sense to test hormones since they fluctuate. Thoughts? I'm in perimenopause. So that's what you commonly hear from traditionally trained OB-GYNs. And I might have said that to you 25 years ago, but what I can tell you is that for the last 20 plus years, I have been checking hormones. I have found it useful, and I know when to check it. That's kind of like telling a patient who's a diabetic, don't check your blood sugar because it fluctuates. It does. Minute to minute, hour to hour, your blood sugar will fluctuate. But what we tell diabetics is check it before you eat. Check it 2 hours after you eat. Check it in the morning before you eat anything. Check it at bedtime. We tell them when to check it. We look at what the blood sugar is in relation to what they eat. So that's how we deal with hormones. We know when to check it, why to check it, and when in relation to your hormones. That hooded Palestinian chick, 45-year-old female, testosterone of 26. Should I be supplementing? My TPO antibodies are negative. Well, so your TPO antibodies have to do with thyroid, not testosterone. And with you at 45, I would be interested in a few more things than just your total testosterone. I'd want to know your free testosterone. I'd want to know your sex hormone binding globulin. I'd want to know your dihydrotestosterone, your DHEA, your DHEAS. So that's only part of it. That's like asking me to do your taxes and just giving me one W-2, and maybe you had 5 jobs. That's only part of the information. And a question coming from YouTube.
Cindy wants to know, is it okay to take HRT at 65 years old?
Cindy, that was another article I just reviewed today. Don't ask me to quote the specific statistics, but what they said is that there's no reason to stop it at 65. I'm guessing that you've already started it. So the issue is we don't want to start it after 65, but if you're already being on it, there's no reason to discontinue now, according to the American College of OB-GYN and the Menopause Society. And there was an article published that they looked at all the causes of death and all the benefits, and there was significant decreases in dementia, breast cancer, cardiovascular disease, osteoporosis, and other disease processes for people who took HRT over 65. Now, the dose matters, the type of HRT matters, so we can't just say if you're on synthetic Premarin and Prempro, it's fine, because the data is different based on what you take, and the dose, of course. All right, KMRRH, I'm trying to find the right hormone, 59 in menopause, but they've all killed my libido. So I'm really hoping you're doing a transdermal estradiol, either in a gel or a patch. I'm hoping you're doing a micronized progesterone rather than a progestin like Provera or levonorgestrel or something else. And I'm wondering if they've actually had checked your progesterone, your testosterone free in total. The other thing that I'm seeing is my patients with the really flat cortisol curves. If someone's checked your cortisol, that is a result of chronic stress. We're using oxytocin with those patients and having great results. So that might be something that might pertain to you. Another question from YouTube.
Margaret would like to know, she's wondering if 0.025 milligrams a day is the lowest dose available. And I think she's referring to Cindy's question about HRT.
So that is a dose of an estradiol patch, and that is not the technically lowest. There is a 0.014, which is called Menostar, which is clinically only indicated for prevention of bone loss or treatment of osteoporosis. So it's not really a hormone therapy categories, but it is estradiol. I don't even know if it's available anymore, but yes, the 0.025 is generally the lowest dose. If we have patients that have side effects with that, we would generally do a compounded medication in the form of Bias, which is estradiol plus estriol, and then we can give a much lower dose. And I have some patients that have a lot of relief from their symptoms with that lower dose. Stephanie De La Garza, how do you naturally keep your progesterone high for fertility? So progesterone does decrease as you age. So if it's an age-related decline, it's really difficult to keep it up. But having said that, if you're 20s and 30s, you want to make sure you're addressing your cortisol, you're getting your sleep, you're eating good quality food. We've had some luck with Vitex, which is chasteberry, and also seed cycling. I just did a post in TikTok on that, and I think it's also on Instagram. If you're not following me on Instagram, I'm Hormone Guru MD. That post is there about naturally raising your progesterone. User 4849309, my Akron buddy, thoughts on Prometrium. So Prometrium is the name brand to bioidentical FDA micronized progesterone. So we use it a lot. Okay, KMRH, I think I gave you some suggestions. Cha-cha-cha, severe bloating, menopausal, what can I take? So I think you're referring to a person, cha-cha-cha, who does not take HRT, and there's actually some studies. It's exciting that the microbiome, we're getting all this research about it, and that women who go in menopause, they have changes in their microbiome, and that's the bacteria in their gut. And so they saw specifically in women who had premature ovarian failure, that's premature menopause, they did studies on their gut microbiome, and they saw that there was changes in the bacterial balance similar to like men. And when they gave those women HRT, those changes reversed. Now, having said that, cha-cha-cha, if you are not someone that wants to take HRT or can't take HRT or doesn't have access, what are some things that you can do for bloating? You may want to investigate a good quality probiotic. They do not need to be refrigerated. I look for about 20 billion colony-forming units with at least 6 strains, and take it on an empty stomach. 2, you might want to see if digestive enzymes help you to eat those before you to try those before you eat. That could also be helpful. We hear thoughts on women on testosterone cream in perimenopause. So that is a great question we hear. Right now, the indication, it's not even the FDA because it's not FDA approved for anyone. So the indication for testosterone according to the Menopause Society is for postmenopausal low libido. All that means is that if you're premenopausal, it's considered off-label, which we do prescribe it off-label for those people that we think it might help. Now, what are the reasons we would prescribe testosterone? Well, first of all, we want to see that all the testosterone indices are low. That's free and total, that's DHT, and your androgens, DHEA and DHEAS. Sometimes we use DHEA knowing that it's going to increase your testosterone instead if that's the cause of your low testosterone. But we have prescribed it off-label for those patients with low libido in perimenopause. Aid, my testosterone DHEAS is high. Is it possible that I have PCOS? My period is very irregular. So that is one of the clinical indications, aid, of PCOS, but the second is irregular periods. So it could be that you're young, it could be that you're stressed, there could be other reasons. Renee Champagne, should I ask my GYN about testosterone? I started on estradiol in May of 24. I have so much anxiety. So I'm wondering, Renee, if you are actually taking progesterone. And so there is an increased risk, and one of the studies I reviewed today did say overall, taking all the data into consideration, women who took estrogen only, even when they don't have a uterus, there was an increased risk of breast cancer the longer you took it. It wasn't there if it was less than 1 year, but the longer you took it, certainly up to 15 years, there is an increased risk of breast cancer. So I would wonder, Renee, are you on progesterone? That could be part of the issue. Progesterone can increase your testosterone as well. And so you could ask your GYN about it, but it'd have to be a GYN who has extra training in hormones and is comfortable with that. Gina 89890, any supplements to make TSH go back to normal? So what does your thyroid need? What are the supplements that you can use? Iodine, but not a high dose, 4 micrograms, not very high. Selenium, 200 micrograms. If your zinc is low, that might be an option for you, usually 15 to 30 milligrams. If your iron is low, we usually recommend ferritin or ferrous glycinate, ferrous bisglycinate. And sometimes ashwagandha can help that as well. But I'd really want to know, Gina, why is your thyroid abnormal? So I'd want to know if you have thyroid antibodies. I'd check your gut out, and I'd probably tell you to eliminate gluten if you had thyroid peroxidase antibodies. Coastal castor fishing. I have hereditary and edema and high blood pressure. If I take testosterone therapy, is it okay? Coastal castor fishing, I'm assuming that you identify as a male. So those are not reasons to not take testosterone. Those actually may be results of low testosterone. So there was another article that came out this last year that did circle back and say for males and testosterone, there doesn't appear to be an increased cardiovascular risk. So I definitely think that you should get evaluated for that. Kimberly, is there a progesterone patch? I wish there was a progesterone patch. Progesterone is a much larger molecule than estrogen. If we look at the steroidogenic cascade, it's on the left side and the estrogen on the right side. Just means it's chemically, structurally different. So it's really hard to get that into a patch. So no. If you're wearing a patch and you've been told it's progesterone, it's a synthetic progestin, like in Combi Patch. Ardit, why is synthetic thyroxine usually prescribed for hypothyroidism and not bioidentical hormones? So first of all, the meaning of bioidentical is that it is chemically, structurally the same to your hormone. It doesn't talk about how it's made. We